Good evening, I'm China Green. We interrupt your programming for a press conference at Riverbend Hospital. We're going to go there live now.
Our hearts go out to the family and friends who are affected by this terrible news. And we also want to thank the colleagues here at Peace Health for doing all they could to prevent this from happening. The specifics of this, as I said, will be shared by Dr. McGovern, but we want to make sure that the community knows that the Peace Health system did all that they could to prevent this from happening, and if we all work together, we can prevent more of these events from occurring. We know we won't be able to prevent more infections, but we do believe that if we work together, we'll be able to prevent more terrible events like this evening. Dr. McGovern?
So first, I'd like to express our condolences to the family. As members of the community, our hearts and prayers go out to them. On March 14th, a woman in her 60s began to have problems at home, called EMS or 911. EMS responded and brought her to the emergency department here at Riverbend. Unfortunately, she expired in the emergency department here on the 14th. So at this point in time, we are in the process of notifying our caregivers. We have been in touch with the family, and we're moving through our investigative processes at this point in time.
So to be clear, this is a separate case from the one that was previously announced earlier today?
Correct.
This is our second case.
Can you give us an idea of whether or not there are other patients in this hospital currently thought to have COVID-19?
We have a number of patients who have tests out, but no other positive patients at this point in time.
How did this patient arrive at this hospital again?
Via ambulance.
Are they from the Eugene-Springfield metro area, or is that information allowed at this time?
I forget the language, but yeah, the metropolitan area, yes.
Can we be more specific? Was it within the city limits of the Eugene-Springfield area, or are we talking about broader Lane County?
So our contact, and we just found out about this, we got the test results today, recently, and our contact investigation at Lane County Public Health is ongoing, so we don't know all the specifics yet.
So what do you want the public to know if they have the symptoms? Who should they call? What should they do?
I think call your physician, care provider again. Do that phone triage. If you feel sick enough, they'll help direct you to either an urgent care, a clinic, or the emergency department based on the level of your symptoms.
I don't know if I caught this, but they were brought to the hospital today, or was it?
March 14th.
March 14th.
Yes, we were notified early this evening of the test result.
Can you give us an idea again of how it became clear that this patient did have COVID-19?
The emergency department physicians who responded and cared for her in the emergency department felt in their judgment that she was at risk, or they saw things that made them suspicious for coronavirus, and so they tested her at the time that they were caring for her on the 14th.
And how about those caregivers that were exposed? Are they in self-isolation right now? How are you guys treating them?
Again, right now we're going through and identifying our caregivers that were involved, notifying them, going through the appropriate procedures, and investigating.
What are the next steps now that we're beginning to have cases appear here in the local area? What calculus does that change for public health officials?
So for public health officials, things do change because we now have contact investigations and we have work to be done to keep others safe in the community that have been directly exposed. For the rest of the community, the message is still the same, that this is a virus that spreads respiratorily, and many people are at risk because of their potential exposure, and we want to make sure that they know how to decrease those exposures. And I think probably the public has heard this a great deal, but there are many things they can do to make a difference. Social distancing, keeping yourself 4 to 6 feet away from others is important, and staying home from work or from school if you're sick. We know that our school systems have helped us with that by closing schools for some time. And also just the simple things of covering your cough and sneeze and washing your hands. I know people have heard it repeatedly, but it works very, very well. And we know soap and water kills this virus readily. So we really want to get those messages out.
So just for some of the folks who have joined this live stream since we started, can you just repeat the basic facts of why we're here tonight again?
You want to go ahead?
Sure. On March 14th, we had a patient who was unknown to have coronavirus or COVID at that time present to the emergency department in Riverbend, and unfortunately she expired in the emergency department. We did get the test results today. showing that we had our first suspected death from coronavirus in the community.
And that death was on the same day that this patient was admitted?
Correct.
All right, with that, I think we'll let our doctors get some sleep and continue doing the work they're doing, and you can follow up with me with any questions you have after this.
You just heard it there. Riverbend health officials just announced the first Lane County death. Just to recap, we know it is a woman. She went into the hospital at March 14th, and then she later died at Riverbend. Officials are identifying who came in contact with that woman. Of course, we'll have more details tonight on KEZI 9 News at 11. We'll see you then.